Hello, everyone. Welcome to our webinar where we will be reviewing blocks all ambulatory anesthesiologists should know, led by Drs. Ashley M. Shilling and Dr. Grant A. Neely. I am Dr. Alberto Arden. I am an assistant professor of anesthesiology at the Mayo Clinic and chair of the Regional Anesthesia Committee for SAMBA. I will moderate this webinar. For those of you who are not SAMBA members, please consider joining the society as it offers many benefits to the members, and please visit our website, www.sambahq.org, to see these benefits of membership. A few quick housekeeping notes before we get to today's presentation. In the upper right side of your computer screen, you will see a control panel. Please note that this webinar is listen-only mode. Submit your question in the chat box. You can type in a question or comment and submit it at any time during the presentation. However, know that we will hold all questions until the end of the presentation, and we will have designated time to answer these. As a term of introduction, today's speakers are Dr. Ashley Shilling, who is an associate professor of anesthesiology and orthopedic surgery at the University of Virginia. She is the co-division chief of regional anesthesia and directs the Regional Anesthesia and Pain Medicine Fellowship. Dr. Shilling is the co-medical director of the University of Virginia's 12 Operating Room Outpatient Surgical Center. Her interests include ambulatory anesthesia, regional anesthesia, orthopedic anesthesia, and medical education. Grant Neely is a current regional anesthesia fellow and clinical instructor at the University of Virginia. He graduated with an undergrad degree in biochemistry from West Virginia University. Grant continued his training at West Virginia University for medical school and residency, where he served as chief resident in 2019. A large component of his fellowship training and practice has been in ambulatory anesthesia. And now, without further delay, I will hand the presentation over to the speakers.
Hi, thanks for being with us tonight, and we're going to get started. So let's see. Just trying to get the slides to advance. Give us just a second. All right, awesome. Sorry about that. So welcome to our webinar, which is blocks every anesthesiologist should know that does ambulatory anesthesia. And wanted to start off just by telling you a little bit about our practice. As Alberto said, we're at the University of Virginia, and we have a 29-bed main hospital and then a 12-bed outpatient surgical center. And we do about 9,000 blocks a year, blocks and catheters, with really the majority being done at our outpatient surgical center. So the goals and objectives of tonight are to help you all create a toolbox that's filled with really the most essential blocks that will cover most surgeries that are done at ambulatory surgical centers. So we're going to choose really high yield blocks. And I want you all to understand the indications and the risks of each of the blocks that we're going to discuss. We're going to talk briefly about the complications of the blocks and then really focus on some of the technical procedures of performing each of these blocks. So to start, we're very biased. We're both regional anesthesiologists, and we really believe in the benefits of regional anesthesia from the patient outcome standpoint, certainly efficiency, patient throughput. So we believe regional plays a really huge part in the ambulatory surgical setting. And there's no better time to focus on regional anesthesia than right now with the opioid crisis that we're in. So the use of opioids has been increasing, and opioid deaths has been increasing steadily since 1999, with about 130 Americans dying daily from opioid overdose. So anything we could do multimodal to avoid opioids is critical. So Grant and I made a little list of some of the most important blocks we felt like we should cover tonight. And so we're going to cover each of these starting from the top. So that's a joke. Even though every one of the blocks on this list is important, we believe that you can do the majority of your practice in ambulatory anesthesia with just a few basic blocks and really learning those blocks well. So the blocks we're going to cover tonight, we're going to talk about the interscaling block as it's critical for shoulder surgeries. We're going to talk about the brachial plexus block. We need one other block besides interscaling of the brachial plexus to cover things below the shoulder, and we're going to focus on the supraclavicular approach. We're going to talk about femoral nerve blocks, adductor canal blocks, IPAC blocks, the sciatic nerve block, particularly the popliteal approach, and a TAP block.
Okay, so just going over some ultrasound logistics here. There's been a lot of medical advances in technology, and ultrasound machines have become much smaller and more mobile, less expensive, more accessible. It's kind of now the standard of care for all the blocks that we do. We use our ultrasound machines, so a lot of